Hello everybody, my name is Diana Soto. I am a student at Indiana State University's LPN to BSN program. Today I'll be talking about the sexually transmitted disease called chlamydia. The following are some of the learning topics I would like the audience to learn. So number 1, the audience will learn what is chlamydia. Number 2, the audience will learn how chlamydia is spread. Number 3, the audience will learn how chlamydia is tested. Number 4, the audience will learn how chlamydia is treated. Number 5, the audience will learn how both men and women are affected by this STD. Number 6, the audience will learn how to prevent getting an STD. And number 7, the audience will learn about available resources to them. Before we move forward with the rest of this presentation, be sure to click the link below to begin the pretest. What is chlamydia? So chlamydia is a common sexually transmitted disease, otherwise known as an STD, that can occur in both men and women. Chlamydia comes from the bacteria Chlamydia. This common STD can lead to serious and permanent damage to both men and women's reproductive system. But especially in women, they can be severely affected. It can make it impossible for the woman to get pregnant later, or even just hard for her to get pregnant. Chlamydia can also cause potentially ectopic pregnancies to the woman. Ectopic pregnancy is a pregnancy that occurs outside the womb, which is an unviable pregnancy. Not everybody with this STD develops symptoms. So it's important that you are checked regularly to make sure that you don't have this STD or another. So how is chlamydia spread? Chlamydia can be spread through oral, anal, or vaginal intercourse with somebody who has chlamydia. If your sex partner has chlamydia, they can transmit this whether they have symptoms or not. If your partner is a male, they can also give you chlamydia whether they ejaculate or not. Chlamydia can be spread to the baby during childbirth, and you can get chlamydia again even after you have been cured. So it's important that you know if you have chlamydia, and if you do, that you protect yourself and others by not having sex until you have been treated. So how can you reduce your risk of getting this STD? The only way to fully prevent getting an STD is being abstinent. If you are sexually active, however, using latex condoms can reduce the risk. You would need to use a latex condom anytime you have sex or any intercourse. Staying in a monogamous relationship with somebody who has tested negative for an STD can also prevent your chances of getting an STD. If you are sexually active with new partners, you should be tested every year for chlamydia because, like I said before, not everybody gets symptoms. However, you would still be spreading it. So, what happens if you're pregnant and you've been tested positive for chlamydia? This can put you and your baby at risk for a couple of things. So, the baby may be at risk for being born early, as chlamydia tends to rupture the water earlier than usually expected at 40 weeks. The baby may be at increased risk for eye infection called conjunctivitis, because as the baby passes the vaginal canal, and if the mother is positive for chlamydia, this can potentially be passed on to the baby, causing this infection. The baby can also be at an increased risk for developing a pneumonia. So it's important that your doctor tests you for any STDs when you become pregnant so they can treat you properly and prevent any of these health complications. So what are some symptoms of this STD? In women, you may notice an abnormal discharge, burning with urination, pelvic pain, abdominal pain, bleeding between periods or after intercourse, or pain during intercourse. In men, they may notice an abnormal discharge or a clear discharge. They may have burning with urination, or they may have swelling in one or both testicles. In rare cases with chlamydia left untreated, the person may develop severe joint pain, otherwise known as arthritis, or may develop inflammation of the eye. So how are you tested for this STD? If you suspect you have an STD, or if you're just getting your regular annual screening, your doctor may collect a urine sample, or they may do a swab of your oral, anal, or vaginal area. The swab can then be sent for culture to develop and see if you have chlamydia or any other STD. So it's important that you get tested if you are sexually active or have had multiple partners. So can you be cured from this STD? And the answer is yes. With prompt treatment and medication, this infection can be cured. It's important as soon as you feel like you're developing any of these symptoms that you go to your doctor to be checked. They can order you antibiotics and treatment can be started promptly to make sure you can fight this disease right away. This helps reduce your chances of any complications later in life. What can happen if this is left untreated? Like I said before, you may not have any symptoms. However, this can be dangerous because then you would likely not be treated for this disease. If left untreated, women can have chlamydia spread to both the uterus and the fallopian tube. This can lead to pelvic inflammatory disease. Permanent damage can be done to the reproductive system in both men and women. Chronic pelvic pain, infertility, and ectopic pregnancies can occur in women. Men can also be infected in the tube that carries the sperm. So this can cause pain and fever. Men are less likely than women to become infertile. However, it can happen. So you may be wondering, when can I have sex again? After you have been fully treated and taken all the antibiotics prescribed by your doctor, you can have sex again. Sometimes your doctor may prescribe you only a single dose of medication. If this is the case, you must wait 7 days after that dose to begin having sex. If you are tested positive for chlamydia, it's important that you notify all your partners so they can be tested as well for this disease. They would also need to follow all the same precautions of taking antibiotics and being abstinent until all the antibiotics has been completed. In this slide, I have some resources attached if you would like to learn a little bit more about chlamydia. Thank you again for watching my presentation on the STD chlamydia. Be sure to click the link below to begin the post-test.